Good morning. This is Dr. Timothy Scott Beck. It is July the 28th of 2021, and it's a Wednesday morning, and we're up and running this morning, and we hope that you are too. And if you think you're sick, or you think you're getting sick, or something's falling behind, or you don't know what's going on, that's what we're here for, and we want to help you. So give us a call. I've got 3 people right now answering the phones, and so be patient with us. Just keep calling or leave a message if you need to, okay? All right, so yesterday I talked about the COVID spike, and I kind of left out the vaccination part. A couple people asked me to elaborate a little bit more on vaccinations. And so I want to tell you a few things about those. First of all, I'm vaccinated, okay? And my wife's vaccinated, my mom's vaccinated, my whole family, adults in my family are vaccinated. Now, I chose to get vaccinated based on my own risk-benefit analysis. Based on what I do for a living, who I'm responsible for, my family and my patients, and I chose to get the vaccination. And I don't think I have had any adverse reactions to the vaccinations. Okay, so I am generally for the vaccinations. And I just was talking to the staff this morning, and I was like, you don't want to be the person that passes on the vaccination but ends up dying from the disease. We just don't want that to happen. I don't want anybody to be in that situation, okay? So I do believe the vaccination is readily available in the community, and I think it's free at no cost to the patient. So if you are at high risk, if you're over 50 and you're morbidly overweight, if you've got heart disease, diabetes, asthma, cancers, anything like that, okay, don't test fate on this deal. So anyway, that's my stance on the vaccinations. I tried to get some more information this morning on what's going on nationally and everything, and I can't get what I feel like is credible information. In other words, it seems polarized. But I want to talk to you. The data that I'm getting, the response that I'm talking about with you is not from national news, or not even from the CDC, and not even from the Department of Health. It's from the parking lot, okay? So I'm seeing people come in. I don't need anybody to tell us that there's something going on in the community that the virus seems to be spreading. Okay, so I want everybody to take the appropriate precautions. I don't want to sound too big of an alarm, because I think that can be hurtful to a lot of people and induce fear and things like that. But I do think that it appears as if we're having a marked increase of the appearance of this virus in our community. So let me tell you what we're going to do about it. Okay, so first of all, we've got all of our mechanisms in place that we've had since it's COVID, about you contacting us, not coming in the office, but you telling us if you think you've got COVID. Then we have a way we can see you in the parking lot, we can see you at home through telemedicine, and we can get you evaluated, and then we can actually have you come through and get tested in our drive-through. Okay, but we've even took it one step further. So if you come to our office and you've got COVID, and I want you to listen to this, because this is a great plan. I want you to come by. If you get tested, all right, and you're our patient, we're going to give you we're going to give you 2 prescription medicines, and then we're going to recommend a few more, like ivermectin, azithromycin, vitamin D, vitamin C, and zinc. Okay, we're going to recommend those things, but we're going to take it one step farther. And what I have done is I've coordinated with the hospital, Mountain Lakes, to provide immunotherapy, the antibody therapy for this, the newest one. The one they're originally using, they rescinded the emergency utilization thing for it. So, but they've got a new one out. They're supposed to get it this morning. So what we're going to do is test you, give you those medicines, and then if you meet the criteria for the IV therapy for it, we're going to get you set up for that at the hospital. We've got it all kind of streamlined, so it won't be that hard for you to do. And the hospital knows we're doing this. So as far as the effectiveness of the newer immune therapies, I know they're effective and they make sense. Now, to give you hardcore data on how good it is, I don't have that. Okay, but I've got that available, and I've got available for you in this community. If you're not a patient of ours and you go through there and you're positive, we're still going to give you the information so you can go seek help from your provider. Say, hey, will you order this for me so I can go over there and get it done? And here's the deal, it doesn't cost you anything. Okay, this is a COVID related thing, so even if you're uninsured, we can get you the IV therapy, the immune therapy, the antibody therapy over at the hospital, and it's charged to a special fund. And they're telling me that. So there's really no limitations when it comes to you getting this therapy if you need it. So we're all set up here. Okay. We want to help you. Okay. We want to actively prevent deaths if we can do it. So if you're at high risk, I want you to get immunized with the vaccination. Okay. And if you do come down with the COVID, I want you to do everything you can to prevent yourself from getting COVID. If you do get COVID, I want to talk to you. We want to see you. We want to help you. We want to test you, confirm that you got it, and get you the highest level of care that we can in this community. And I hope we don't have to test out too much the system, but we've got this in place, and I want you to know it's there, and I want you to know we're working very diligently to help you with this. And I want you to do your part by staying safe, getting your vaccinations, wearing your mask, using hand sanitizer like it's going out of style, and trying to stay out of the way. And one of the things that is interesting is I do believe people are getting sick from the COVID who have previously been vaccinated. I don't have any numbers on that, but I do believe it's happening. Okay, the only caveat I'll tell you on that is theoretically, you can get a disease after you've been immunized, but the severity of the disease is much, much less. So I do believe that there's not a lot of people dying from the disease if they've been vaccinated. So that's one thing you need to put in the hopper when you're trying to do your analysis of whether or not you should get your vaccination or not. I know a lot of people feel it's controversial and they're having a hard time deciding on whether it was the right thing to do for them or not. And I don't think the talking heads are helping us with that, okay? And they're getting us all confused. But my professional recommendation is that if you're at risk, okay, of dying from this disease, I want you to get the vaccine, okay? But I also think it's your personal choice, all right? Listen, we're up and running today. We want to hear from you. We're going to pray that nobody has to deal with this terrible disease going around, but we want to hear from you if you think you got it, and we're going to do what we can to help you. Listen, have a great day, and call us if you need us. Thank you.